Tes tes satu dua tiga. Tes tes tes. Bocor mboten?
Suaranya.
Suaranya sebentar. Headset. Coba cek lagi.
Tes, tes, tes. 1, 2, 3.
Oke, Bu.
Enggak. Bocor, Bu Ilya. Bu Arya, Bu Aul, betul.
Enggak sih. Jelas kok suaranya jenengan
Oh,
saja.
ya udah. Oh, alhamdulillah.
Iya. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning to all our distinguished speakers, honored guests, and wonderful participants. Welcome to the Academic Writing and Publication webinar hosted by Pediomaternal Nursing Journal, Faculty of Nursing, Universitas Airlangga. My name is Arya Auliana Stiti, and I'm honored to serve as your Master of Ceremony for today's webinar with the theme Turning Evidence into One Meaningful Paper. These events aim to strengthen our understanding of evidence synthesis, scientific writing, and publication strategies, skill essential for advancing nursing scholarship. Before we begin today's academic program, let us first honor our nation. Please remain seated and listen respectfully as we play Indonesian national anthem. Thank you. Next, we will continue with Universitas Airlangga hymn. Thank you very much. Ladies and gentlemen, to officially open today's webinar, we are pleased to welcome the Vice Dean for Research, Innovation, Community Development, and Global Engagement, Ibu Nuzul Quraniati, Sarjana Keperawatan Nursing, Magister Nursing, PhD, who will deliver the opening remark on behalf of the Faculty of Nursing, Universitas Airlangga. Ibu Dr. Nuzul, the screen is yours.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam
Waalaikumsalam
Mr.
warahmatullahi
Konwani.
wabarakatuh.
I'm sorry, Ibu Nuzul. The can volume load more?
Tes, tes, tes.
Okay.
Sudah, Bu Aul.
Sampun.
Okay. Okay. Good morning, everyone. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam.
Distinguished speaker, Mr. Konwani Joseph Banda, postdoctoral students from TMU. Distinguished committee, Ibu Dr. Ilya, as AEC Pediomaternal Nursing Journal. The editors of Pediomaternal Nursing Journals, Bapak Hidayat Arifin, Ibu Prabha, and Ibu Aulia. We would like to extend our sincere apologies because our dean is unable to attend today's event due to ongoing official agreement that requires her presence. She conveys her warm regards and appreciation to all participants and hopes for the success of today's program. It is a delight to have all of you here, researchers, educators, students, professionals, and all participants who share a common commitment to furthering knowledge through high quality scientific writing. Specifically in era of plentiful informations, the ability to synthesize varied facts into a single, clear, and effective article is not only a skill, but also a necessary basis for how to conduct research that is actually meaningful. Today's session is designed to walk us through that process, and I'm hoping that the committee wants to facilitate how to synthesize the data, connect findings, refine arguments, and write a manuscript that contributes significantly to the scientific committee. Whether you are preparing your first paper or looking to enhance your publication quality, the insight from the webinar will support you elevate your academic writing and maximizing the value of your evidence. I encourage everyone to stay engaged, ask questions, and take this opportunity to learn from our expert. May today's discussion inspire you to turn your research ideas into publication that spark change, inform practice, and broaden scholarly conversations. Thank you. And again, we hope that success with this webinar. I'm going to end by saying Alhamdulillah, wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam
Waalaikumsalam
warahmatullahi
warahmatullahi
wabarakatuh.
wabarakatuh. Thank you very much, Ibu Dr. Nuzul, for the inspiring words and for officially opening today's webinar. Ladies and gentlemen, we will now proceed to the keynote speech. It's my honor to welcome Ibu Dr. Ilya Krisnana, SCAP Nurse MCAP, as Editor-in-Chief of the Pediomaternal Nursing Journal, who will deliver a keynote speech titled Publication Trend Analysis from 2012 until 2025. Ibu Dr. Ilya, the screen is yours.
Okay, thank you Ibu Aulia for the time. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi warahmatullahi wabarakatuh.
Good morning, everyone. The Honorable Vice Dean, Faculty of Nursing for Research, Innovation, and Community Development, Ibu Nuzul Quraniati, SCAP Nurse, MNC, PhD. Thank you for coming here. The Honorable, our special speakers, Mr. Hidayat Arifin, SCAP Nurse MCAP, and Dr. Konwani Joseph Panda, PhD, RNM. Thank you for the time. Thank you for coming here at this time. And also for all the participants, today I would like to share about the publication, especially in the Pediomaternal Nursing Journal. The title is Pediomaternal Nursing Journal Publication Trend Analysis between 2012 until 2025. Next. Okay. We have six key question or six point for this occasion. The first one is article distribution, and also the second one is pediatric topic trends, and the third one is maternal topic trends, and for the fourth is author distribution by province. Five is author distribution by country, and the last is evidence-based nursing intervention in the Pediomaternal Nursing Journal. Next. We start for the pediatric versus maternal distribution topic. Between 2012 until 2025, uh, approximately about 58.2% is the topic about the pediatric, and then the 41.8% is a maternal topic. And for the year, for 2012 is until 2025. This is the equal percent about two topics. And then next, Mbak. Okay. That this is the pediatric topics trend and evaluation, most published for 2012 until 2025. There are 10 top topics that we are analysis. Number one is about the stunting prevention and nutrition. All period there is a stunting topic, and then feeding behavior and nutrition education all years, and then the child development and stimulation, and the last is screen time, bullying, modern issues between 2022 until 2025. This is about the foundation era. There are 26 articles between 2012 and then until 2040. The topic is about the basic child health, nutrition, development, immunization, educational games like snake ladder, brainstorming, infection disease prevention, and also diarrhea. And then for the transition period, like health education methodologies, limited publication, journal consolidation. And then for the stunting prevention area, it is the most topic that's published in the maternal nursing journals, like a stunting presidential regulation, and also COVID-19 impact on child or children, emergency of mental health issues like a resiliency, hospitalization, stress. And then for the holistic and innovation era, there are 34 articles between 2022 until 2025, like a sustained focus on stunting, refined intervention, expansion of mental health topics like bullying, cyberbullying recovery, and for the digital innovation, mobile apps, virtual reality therapy, modern challenges like screen time, physical activity, and also obesity. Next slide. Okay. For the maternal topics is the first one and the winner is the breastfeeding and lactation support. And the second one is pregnancy complication. Contraception and family planning is also the third, as postpartum care, recovery, antenatal care, and compliance, cancer screening like a breast cancer or cervical cancer, reproductivity, health, and sexuality, and also the last is mental health like a depression or anxiety. Okay, and then research evaluation timeline that we have analysis. There are 18 articles start from the 2012 until to 2014. We call preventive care or ERA, antenatal care compliance, like using health belief model, pregnancy complication like preeclampsia, anxiety management, labor pain management, warm compress, early breastfeeding support, and also KMC for low birth weight. And the reproductive right focus like a contraception, family planning, decision making. And then the next is comprehensive women health like breastfeeding, oxytocin message, peer support, video education, cancer screening awareness, pregnancy complication, etc. And then there are 18 articles like for the topic about mental health and quality of life era like a postpartum mental health, fatigue, depression, self-efficacy, quality of life, breast cancer survivor, and etc. Next. Okay, for the authors distribution, for the Pediomaternal Nursing Journal, most of the authors came from the Java Islands, but also from other islands. Like from East Java is the most come from East Java. Approximately about the 83.5% from Surabaya, Malang, Jember, and also from other district. And then from West Java, Jakarta, Yogyakarta, West Sumatra, and other province. Okay, next. For the international authors, we so proud because Petio Maternal also accept author from other countries. Number one is still Indonesia, and the number second is Philippines, Malaysia, Turkey, South Africa, Thailand, Spain, Timor-Leste, and Afghanistan, and also Japan. For the Indonesia, is all topics are came from, and then for the Philippines, the topic is bullying, nursing perception. From the Malaysia is cancer coping, cervical screening, stunting, and is also from Malaysia. And then from Turkey, like dysmenorrhea, postpartum pain. From the South Africa, like maternal care guidelines. And then from Thailand, stunting reduction rule. And then from Spain is like the topic about neonatal nutrition. And from Taiwan is like a low birth weight, COVID-19 outcomes. And from Timor-Leste, care cancer, hypertension prevention, and from Afghanistan and Japan, elaborate with studies. Next. So, pediatric evidence-based nursing intervention that we have analysis is about the health education program, infant and child counseling, child development stimulation, non-pharmacological pain management, kangaroo mother care, and family empowerment program. Next. Okay. And for the maternal evidence-based nursing intervention that we have analysis in Pediomaternal Nursing Journal is about the breastfeeding support programs, health education for maternal health, psychological support for maternal health, pregnancy complication management, peer group support for mother, and also antenatal and postpartum care education. Okay, the next. Okay, I think that's all from me as a editor-in-chief for Pediomaternal Nursing Journal. Thank you for coming here. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much to Dr. Ilya for the insightful presentation on the publication trend analysis from 2012 until 2025, which highlighted the key topics relevant to our journal. We hope this overview inspires all participants, and we warmly encourage for all participants to submit your best manuscript that align with our journal scope. Ya, jadi terima kasih pada Bu Ilya. Saya berharap tadi topik-topiknya di jurnal bisa menginspirasi dan saya dan kami gitu ya dari jurnal Pediomaternal dengan paparan tersebut memberikan inspirasi bagi peserta untuk bisa mensubmit artikelnya pada jurnal Pediomaternal yang sudah terindeks Scopus ya sejak tahun 2021 Ilya ya. Baik. Oke, next session. Thank you very much, Ibu Ilya, for valuable insight. And then the next session with Ibu Prabha. We will now enter the presentation and discussion session. To guide the next session, I would like to introduce our moderator, Ibu Prabha Dian Rahmawati, as editor Pediomaternal Nursing Journal. I kindly invite Ibu Prabha to lead next agenda.
Okay, thank you, Ibu Aulia, for your time. Okay. Okay, my son is enough, yeah. Thank you, Ibu Aulia. Good morning, distinguished guys, speakers, editor, and all participants. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
And a warm welcome to everyone joining us in today's webinar titled Turning Evidence into One Meaningful Paper that organized by Pediomaternal Nursing Journal. It is an honor for me to serve as the moderator for today's academic event. First of all, I would like to extend our highest respect to the Honorable Vice Dean for Research, Innovation, Communication Development, and Global Engagement that representing the Dean of the Faculty of Nursing Universitas Erlangga. We also extend to our warmest regard to the esteemed Editor-in-Chief of Pediomaternal Nursing Journal, Ibu Dr. Ilya Kesnana, as well as our respected editors and member of the editorial board. Thank you very much for your presence and continue to support this event. Okay, ladies and gentlemen, the aim of today's webinar is to depend on our understanding of the transforming evidence into impactful scholarly publication through both theoretical insight and practical guidance from our distinguished speaker. Today, we are pleased to host two remarkable presenters. Our first speaker is Mr. Konwani Joseph Banda, postdoctoral fellow at the College of Nursing, Taipei Medical University, Taiwan. Hello, good morning, Mr. Banda. Hello, Mr. Banda, good morning. Okay, Mr.
Good morning.
Okay, good morning, Mr. Joseph Bandaya. Welcome to our webinar. We are pleased to have you with us today. Our second speaker is Mr. Hidayat Arifin. Hello, Mr. Hidayat Arifin.
Hello, Dr. Prabhu. Can you hear my voice?
Yeah, of course.
Okay, sure. Nice.
Thank you for joining us to sharing your expertise in today's session. Okay, to begin our session, I would like to invite our first speakers, Mr. Kondawi Joseph Banda. Yeah, Mr. Joseph Banda, are you ready? Yeah. Before we begin, allow me to read a brief curriculum vitae of our first speakers. Yeah, Dr. Kondawi Joseph Banda, PhD, is a postdoctoral researcher of School of Nursing, Taipei Medical University. Yeah, Mr. Kondawi Joseph Banda. Yeah, I'm sorry, Mr. Konwani Joseph Banda. Yeah, I'm sorry for the ini ya. Okay, Mr. Konwani Joseph Banda have the educational background in the School of Nursing, Taipei Medical University for PhD program, and his research interests in cancer research, dysphagia, mental health nursing, older adult, stroke, maternal and child health, yeah, and non-communicable disease, and also meta-analysis. Mr. Konwani having more publication, yeah. There are about more 13 publication. Yeah. I think that's all about the curriculum vitae of our first speaker, Mr. Konwani Joseph Banda. Hello?
Hello.
Yeah, okay, Mr. Konwani. You will deliver a presentation on comparison between scoping and systematic review. Yeah, I think a topic that highly relevant for researchers, yeah, seeking to select the most appropriate review methodology. Yeah. Okay, Mr. Konwani, you will have 30 minutes to deliver your presentation. Yeah, the screen is yours.
Okay, thank you. Can you see my screen?
Yeah, it's okay.
Yeah, I see your screen.
Okay. The dean, distinguished professors, and the audience. My name is Kondwani Joseph Banda, originally from Malawi, Africa. I'm currently
I'm sorry, Mr. Konwani, can you
yes.
full screen? Can you full your screen?
Yeah, wait. It's not full screen now?
Yes, this is perfect,
Yeah,
brother.
already.
Okay.
Okay, this one is okay.
Okay, I'm currently working as a postdoc fellow in School of Nursing at Taipei Medical University. My background is nursing, so I did my Bachelor of Science in Nursing and Midwifery from 2006 to 2010. Then came to Taiwan in 2016 to 2018 to study master's, then PhD from 2018 to 2023. So my area of interest includes cancer research, older adults, mental health, and conducting systematic reviews and meta-analysis. So today I was asked to present on comparing the differences between the systematic review and scoping review. So I'll just give a brief overview of the following topic. So the outline will be as follows. Firstly, we need to understand the review process and how we can select topics to conduct our review. We also have to follow established guideline and develop our own protocol that will ensure that we conduct a systematic and a very comprehensive review. Finally, I'll point out some differences between the two, between scoping reviews and systematic review. So for the review process, mainly we start by identifying the research topic. Then we go and search the databases based on our research question to identify relevant studies. And based on our selection criteria, we do the study selection. After that study selection, we conduct the data extraction and then summarize and report our results or findings. In detail, so identifying the research process, the research question is the most important. I would say is the most important part of the review or systematic review and scoping review. So uh, these two types of review have maybe different contextual areas that we look at. For systematic review, maybe we follow the PICO criteria, and for the scoping review, we follow the PCC. So once we identify the research question, we need to go and search maybe to check if others have already done what we are trying to understand, or what type of review question we want to answer. If somebody has already done it, then we will be not bringing in new information, or we will not be bringing in new evidence. So the idea is that we have the research question, then we go and search and see if others have already done what we want to do. So if we find that nobody has done what we want to do, then we go into the next stage. So for the systematic review, we follow the PICO criteria, which is most specific. So we have a defined population, a defined problem, and we can have specific interventions, and the specific interventions have a different comparator, or the exposure also has a different comparator and outcomes. For the scoping review, it's usually broad. We also have a defined population, but we have a concept that we want to understand, and in a certain context. So once you identify your research question and you find that nobody has done it, the next is to develop a protocol. So why do we need to develop a protocol? Uh, to ensure transparency in research and ensure that others will not want to do the same idea, because if you are in Indonesia, you have an idea, you might think that maybe you are the only one who has the idea, but across the world, maybe in different areas of our research, we have other people who are doing the same thing and might be thinking about the same topic. So the first step is, if you find that nobody has done it, then you register your review study first, and then you can continue to do it. So for the registration, you need to develop your own protocol. It's more like a research proposal with the background, the methods, and maybe a little discussion of what you intend to do. And these can be registered on different platforms, including Prospero, Open Science Framework. We have Systematic Review, BMJ Open, and JBI Evidence Synthesis. So to note, Prospero does not accept scoping reviews, and currently you can only register for interventional studies. I think they are trying to upgrade their system, so you can only register a protocol for an interventional study. But for the other types of designs, they are still trying to upgrade, and I think maybe in the near future they're open to, so that others can register for those. Currently, maybe you can use Open Science Framework and the others, which can be able to do the same. So once we develop our protocol, because there are guidelines that help us to conduct this study, different checklists have been conducted to ensure that you include all the necessary items that are needed into the different types of studies. So for the systematic review, you need to check the Prisma P. And from this checklist, you can see that there are different types of items, from the title up to the discussion and the content of the whole manuscript. So based on these items, we can make sure that our research protocol is very rich and includes all the necessary items that need to be reported regarding the particular review. So for the systematic review, we use the Prisma P checklist. And for the scoping review, we use the Prisma scoping review. So those items help us to make sure that we have done the right steps. And once we finish our study, it'll be easier for maybe if we send it to a journal, the reviewers will be easier to critique it And we also make sure that we have a very comprehensive and rigorous study that can be able to contribute to the evidence base. So after registering our protocol, that means we are set to move into the next area. Hello. Excuse me, I need to answer a phone for a few minutes. Is that okay?
Okay, it's okay. You can. Okay.
Hello, can we take a 5 minutes break? I
It's
need
okay.
to
It's
see
okay.
my
You
professor.
can. Yeah, you can.
Oh, okay.
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 Yeah. Sorry, Mr. Hidayat Arifin. It's okay if you change the time for having speakers.
Hello. Can you
Hello.
hear my
Yeah,
voice?
hello. Yeah.
Okay, sure, Dr. Prabha, it's okay. I would love to.
Okay, thank you. Okay, ladies and gentlemen, because of some reason, Dr. Konwani have a break for a while. Yeah, I will continue for the second speaker. Yeah, our second speaker is Mr. Hidayat Arifin. Yeah, the editor of Pediomaternal Nursing Journal that will present about pairwise meta-analysis, a brief introduction. Yeah, we believe that this session will enhance our understanding of our fundamental of quantitative
Is my
evidence
connection off?
synthesis. Yeah, Mr. Hidayat Arifin, are you ready? Yeah, Mr. Hidayat Arifin, I will read your curriculum vitae first. Mr. Hidayat Arifin. Yeah, Mr. Hidayat Arifin, his educational background is now a PhD program in nursing in Taipei Medical University, start from 2022. His research interests in primary research focus on medical surgical nursing, chronic illness management, and evidence synthesis through systematic review and meta-analysis. He have a Scopus high index 17, yeah, and Web of Science high index 13, yeah, it is, I think, is so high, yeah, Mr. Hidayat Arifin. Mr. Hidayat Arifin having a work experience. Now he as a lecturer, yeah, in Faculty of Nursing Universitas Erlangga, and also editor in many journal, yeah, not just in editor of Pediomaternal Nursing Journal, but also in Inject Journal, yeah, Universitas Pajajaran Journal, editor-in-chief in Journal of Palembang Nursing Studies, yeah, lead of guest editor in Malaysian Journal of Medical and Health Science, academic editor in of Peer Journal, and associate editor of the Journal of Holistic Nursing. Yeah, Mr. Hidayat Arifin, are you ready to present your material?
Sure, yes, I am. So isn't my voice is clear enough?
Yeah.
Okay, sure. Thank you, Dr. Prabha, for your time, for your introductions about me. And now let me share my time. Let me share my screen. Can you guys see my screen now?
Yeah, I can.
Okay, is it very clear now? Okay, sure.
Yes, clear.
Okay, thank you very much for the time, and also the honorable to the Vice Dean 3, Faculty of Nursing, Universitas Erlangga, Dr. Nuzul, and also our beloved Editor-in-Chief, Dr. Ilya Krisnana, and of course the speakers. Actually, my brother, I believe that currently he has a very urgent call, so he need to take a leave a moment. And also for all the editors and also all the participants, thank you very much. And yeah, actually, it's a bit far from me because I have to share my information. Actually, it's not that full of information. It's just we share only what I know, and it doesn't mean that I am expertise in this field. Like I just want to share you guys about what I'm knowing, and I would love to share everything that I have to you guys. And currently in Taipei, we have a very good weather because this is a transition between autumn to winter. So the weather is quite good. I hope in Indonesia, the weather also quite good. Or maybe Indonesia is rainy, Dr. Prabha? Or it's very hot now in
Yeah,
Surabaya.
now rainy.
Rainy, oh nice. I hope everything is well because I think yesterday I got the news that the Semeru mountain is eruption, right? I hope everything
Yeah,
is goes
Semeru.
well.
Yeah,
Yes, I hope everything
Semeru
is goes well in
eruption.
Indonesia. And and yes, everyone, today I would like to share a very pleasure for me to share about the meta-analysis. This is a brief introductions, and in this session I would like to be focused on pairwise meta-analysis. Have you guys ever heard about the pairwise meta-analysis before? Any one of you ever heard about pairwise meta-analysis? It's okay for this session. We just trying to be enjoy. We're trying to be chill during the slide presentations because I believe that it's quite hard. It's quite difficult thing, and maybe some of you will listen many kind of the new terms about the study. It's okay. We just learn because I would like to know. This is just a brief introductions. If you guys in the futures you want to learn about the meta-analysis, from the very beginning to the end of the manuscripts, I think it's quite takes time. And I hope that in the futures we can have like an offline workshop, like 3 days workshop. I believe it can be held if you guys want to know from how to analyze as well, to do a meta-analysis. Okay, so in the very beginning, I believe that in this world, there are so many studies, there are so many research. It's kind of physical research, medical research, any kind of research. Even there are cross-sectional RCD, non-RCD studies. I believe there are a lot of research that also has been published in any kind of reputable journals or even non-reputable journals. And sometimes you guys, when you want to write this kind of projects or you want to write a proposal or something, you guys maybe will think about which the papers that I have to follow, right? which the journals, which the papers, they can provide a very sufficient information, so I can use that as my reference when I create the protocols or when I create the proposals. That's become the most challenging questions. And also, should we go to the meta-imbalance for asking which one is the best paper or which one the intervention is and how the quality? Because I believe that from a million papers that publish in the databases, they have very quality, they have very type of interventions, they have very of the intervention protocol and other thing. So how we deal, because for example, like in Indonesia, for example, like Dr. Ilya, she conduct a research about to develop about the quality in pediatric nursings. And also in Malaysia, there are another researchers, they also conduct the same intervention. And also another researchers in Taiwan, for example, they also provide almost the same intervention. So which you guys will refer to? Or you should only follow Indonesia, or you just only follow in the each region of countries or something. It's become the challenge for you to decide. So that's why. Or maybe how if we conduct meta-analysis. So how can the meta-analysis and meta-analysis they deal with the many kind of the interventions, many kind of the studies? So I just want you guys to know about the definition of meta-analysis itself. So the meta-analysis is to combine the results from multiple studies to increase the statistical powers, provide a more precise and reliable estimate of an event, and resolve the conflicting and unclear findings. So, for example, I just want to make a simple simple figure. For example, like in Dr. Ilya's studies, as I told you, they have the significance between intervention A to the quality of life among pediatric population, right? And also other study, they also have the significant as well, and also another researchers from another words. So by using the meta-analysis, we will combine all the significance, all the statistical powers, all the effect size, all the mean SD to be one study. So we will combine all the statistical results to be one, and we can judge that this intervention, the effect size is blah. How many the effect size? So by the meta-analysis, we can identify the effect size is mild, moderate, or even high effect size. That's how we're going to do. Okay, so if the systematic review, we only talk about the narrative or descriptive. For example, from 10 included studies in the systematic review, you can just only say that 8 studies that have significant effect of intervention A and B. But if only using the systematic review, we don't know how many the effect size, how many, like what kind of effect size level, mild, moderate, or high effect size. We cannot evaluate that in systematic review. That's why we need a meta-analysis to prove that the significant is really significant. And also we can see how, what type of the level of effect size itself. So, and also that actually start from the 1987 actually, like the first published paper about meta-analysis until 2020 now, until now 2020. There are so many significant published papers about meta-analysis. Of course, when we talk about meta-analysis, maybe the quality can be varied. That's why if you want to do the meta-analysis as well, we can also evaluate about the study quality itself through the meta-analysis. And I just want you guys to know this is just some common terms in meta-analysis. So maybe during my slide presentations today, you guys will listen about a forest plot, a vinyl plot, heterogeneity, publication bias, Prisma. I believe you guys very common with the Prisma term, right? And also effect size, mixed effect, random effect, subgroup analysis, meta regression. So all of these are the most common term in the meta-analysis. So during the slides, I will mostly use any kind of this term, especially for the effect size. Okay, because when we talk about the meta-analysis, we're going to talk about the effect size. Okay, if you guys any question later, we can discuss. Okay, and also I just want you guys to know about the type of meta-analysis. Actually, meta-analysis they have so many types. It's all just depend on what you need. For example, I want to evaluate or maybe I want to compare the intervention A to the intervention B. I want to compare between the intervention A to the control group. So you guys can use the pairwise meta-analysis. So only single intervention versus single interventions. Okay, intervention A versus intervention B, or intervention A versus control group. Okay, we can use the pairwise meta-analysis. And how about the network meta-analysis? This is just brief explanation, okay? Network meta-analysis, if you guys, you want to evaluate from many kind of intervention, which one they have the best effect size, which one they have the highest rank. So we can use the network meta-analysis. For example, you guys want to evaluate the non-pharmacological intervention related to quality of life, for example. I believe that the non-pharmacological intervention, they have so many, right? They have many kind of non-pharmacological intervention. So you can evaluate which the best intervention they have the effect size to the outcomes. So you can use the network meta-analysis. So not only one by one, okay? That's we call network meta-analysis. And also they have the association studies or association meta-analysis. So you guys can make association. For example, I want to evaluate between the sorry. For example, like eating behavior to the body weight, for example, right, among pediatric population. So you can use the association studies. Okay, and also this is an interesting one, diagnostic accuracy test. So for the diagnostic accuracy test meta-analysis, you can evaluate from many kind of tools. For example, I want to evaluate the quality of life tools or instrument. Which one they have the best one when we compare to the gold standard? So we can use the good diagnostic test accuracy. Okay. And also we have the prognostic factor studies. Also, we can conduct the we can conduct the meta-analysis to evaluate which one the best prognostic. And also the prediction model as well. For example, we have so many kind of risk factors. Many kind of risk factors, for example, the early childbirth or something. And then we can evaluate how many the prediction models, how many the pools risk ratio or hazard ratio or odds ratio or something. We can use the prediction model. And the last one is the prevalence, incident, and risk factors. We can also evaluate by using the meta-analysis. And I would say the prevalence, incidence, and risk factor is it's quite easy to do in the meta-analysis. And also they can provide a very meaningful data. Because for example, if you wanna do the prevalence studies, I wanna evaluate how many children with special condition in the world. You can use the prevalence meta-analysis. Okay, so this is the kind of meta-analysis. What do you need meta-analysis can provide? So they have so many type of meta-analysis you can choose to your study. Okay, so why meta-analysis? Why meta-analysis? Because many of the groups they provide the small sample size. For example, one study that conducted in Surabaya, of course, the population they only limited in Surabaya, right? So how can we generalize our intervention or our finding? It's quite difficult. That's why we need meta-analysis. We can combine from many kind of studies in the world, so the studies can be generalized. That's the main purpose for the meta-analysis. Okay. And also, this is a steps. I believe that Dr. Joseph he already explained some in the very beginning, like the steps to conduct the systematic review or scoping review. Actually, all the same. All the same start formulate the review questions and then consider PICO. Okay, in this study meta-analysis, we focus on PICO, but depend on the type of meta-analysis. Okay. And after you consider PICO, you guys need to prepare the protocols, develop the search strategy. And in this part, I believe that later Dr. Joseph will explain about the develop search strategy. This part is very important part. Very important. Very important when you define your keyword based on the databases, and also what's the databases you choose. This is very important part in this section, develop search strategy. Because if your keyword is relevant, your keyword is strong, your database is many. I would say many databases, not only one, two, or three. Okay. I believe it will improve your inclusion studies, your inclusion criteria, your included studies will be many. So when you have many studies, you can generalize your study during the meta-analysis. And after that, you guys need to select studies or the study quality. Okay, the study quality. So you have to identify which my included studies, they have a good quality, they have fair quality, or maybe they have low quality, or maybe they have some concern quality of study. And also, after that, you guys need to extract the data. What extract the data in the meta-analysis? Of course, you guys need to find the data. Most of the data we need in the meta-analysis is mean SD. Mean SD pre-post test. Okay, mean SD pre-post test, or maybe if the data they provide in mean standard error, you guys have to convert the data to mean SD. Okay, and if you guys using the CMA software, later I'll show you the type of software we can use in the meta-analysis. For example, if you guys using the CMA, you can use, or maybe you can input many kind of the data types. For example, the p-value, parity test p-value, you can input it in the CMA. So if the study they didn't provide the mean SD pre and post, or maybe the study they only provide the mean difference and also the p-value, we can also input in the CMA as well. That's why I am in the meta-analysis. I would like to suggest you to do to use the CMA as well in the futures. Okay, after you guys keying the data, and then you guys need to analyze. Okay, analyze. You guys will see how many the effect sets or something. And after you analyze, actually there is one more steps to evaluate the quality of your outcome. We use grade. Have you guys listened about the grade? Grade is to evaluate the study outcomes. Your outcomes, they have a moderate or mild or low quality. That's it. We use the grade as well. And after this, like what I would like to say, when you guys, the first step, you guys need to develop the first question. This is question is a very important thing. In the pairwise meta-analysis, you just need to develop what is the intervention A, they have significant effect to the outcome compared to the control group. Mostly only one research questions. Okay, but if you want to provide many kind of research question, that's fine. No problem. It's depend on what you want to evaluate. But something I want to remind you, you cannot combine some meta-analysis. For example, I also want to evaluate the prevalence or something. Meanwhile, you are using the pairwise meta-analysis. No, you cannot combine that. Because for the prevalence, we use PEO concept, and also for the intervention study meta, we use the PICO. It's quite different, so we cannot combine. Okay, so you guys need to be wise when you develop the question as well. And this is the defined inclusion and exclusion criteria. Usually in the pairwise meta analysis or meta intervention or the network meta analysis, we use the PICO. I believe you guys are very common with this term, PICO, population intervention control and also outcomes. For PEO, population exposure outcome, we usually use for prevalence meta-analysis. Prevalence meta-analysis, we usually use the PEO. And for a spider, sample, phenomenon of interest, design, evaluating, and research type is mostly using for the qualitative study. Okay. What is the qualitative study and meta-analysis do they have? Actually, the name is not qualitative meta-analysis, but the study will be the meta-synthesis. For qualitative study, the name is meta-synthesis, not meta-analysis. And also, for example, this is the TIRO, population index test, reference test, and outcome. These terms we use to do the diagnostic test accuracy meta-analysis. Okay, this is like the common term for you guys' informations. And just for short, I would like to remind you about the different types of databases because I believe that many of you still confused. Not, I'm sorry, not many of you, but many author, they sometimes like confused when defined about the database and also the online search. Okay, so in this box, it's like the most common databases, so like Web of Science, Scopus, Sinahal, Embase, PubMed, Medline, ProQuest Info, and also Central or Cochrane Library. This all are the databases. Meanwhile, like Google Scholar, SenseDirect, Sage, Springerlink, and anything, they are just the online search or or publisher. So you can use integrating together. But if you say that we use, but if you see, if you guys mention the Google Scholars as the database, that's incorrect actually for the term. Okay, so Google Scholars is the online search, not databases. Next. This is just for short. If you guys use the meta interventions or the pairwise meta analysis, pairwise meta analysis, one of the studies that you have to choose is the central or concurrent library, because the concurrent library or central, they can complete many kind of the databases inside of this. Okay, and also when you guys conduct the meta intervention, what is the best study should we include? I would like to suggest the RCT studies. Okay, why the RCT? Because you know that the highest level of the studies in the intervention and in the experimental study is the RCT. Okay, so if you have sufficient studies about included studies from RCT, I suggest you choose the RCT only. For the non-RCT, like quasi experiment, you just exclude. That's it. Okay. And in these slides, this is a very, very important thing. Search terms. Okay, search term is very important thing. Like you have to identify the keyword in each databases. For example, this is the keyword in Chinahal. In Chinahal, they use the medical headings. For example, the neoplasma, they identify as the medical heading, not mass. Okay, maybe you guys very common with the term of mass, medical subject heading. But in Chinahal, they didn't use the medical subject heading, but they use major medical or something. I forgot the name of this. Okay, so they have their own term, major subject heading or MM. Okay, so that's the common term in the Chinahal. So you have to identify, you have to make lists from your PIS. For example, in the study, I want to conduct the meta interventions, but in my study, I only use PIS. Where is the CNO? Where is the control and outcome? I didn't mention here. Because in my study, I will compare my interventions to any kind of control groups. And also the outcome, I didn't limit to the outcome. I will see how many outcomes they have and I will analyze on it. So if I use this method, I will have so many kind of outcomes, which is very good in meta-analysis, rather than you specific to the specific outcome. Okay, it's just if you guys in the future you have expert in the meta-analysis, it will easy for you guys to follow up about this way. And also this is like the sample for the Cochrane or Central Register of Random Control Trials in the Cochrane Library. In the Cochrane, they use the mass. Okay, like PubMed, they use mass. Cochrane, they use mass. Scopus and Web of Science, they don't have the specific terms. Okay, for Embase, maybe you guys have heard about the Embase database, they use M3. The name is M3. So that's different. If you want to guys submit to the if you guys want to submit your paper to high impact factor journals, you have to identify this keyword very, very rigorously, because if not, it will be increase your rejections. Okay, because I would say that the keyword is like the foundations of you to recruit your included articles. If your keyword is not sufficient, if your keyword is not reflect to the topic that you're going to do, I believe that the included study will be limited. Okay, that's become the constant as well. And also this is the syntaxes. I just want to show you, this is the syntaxes in this Cochrane. So every databases, they have different syntaxes to recruit the articles. Okay, for example, just for your information, this is the syntaxes used in the Cochrane library. And also this is the Medline. See, they have the differences between these two, different style. Because every database, they have different style during the search strategy. So if I am become the editors, or I become the reviewers, it's very easy to me. Just see the keyword first and then see the syntaxes. If the syntax is error, or the syntax is weird, or maybe the keyword is not sufficient, it's easy for me to reject. Okay, because this is kind of the foundations of the during the systematic review and meta-analysis. Okay, this is just for short information. Now go to before the subject could be set in a clear and proper light, it was necessary to remove a great deal of rubbish. Okay, so I believe that, for example, you guys recruit five databases. I believe that you will see so many duplicates, right, in your studies. So you have to delete. I'm sorry. So you guys have to. So you guys have to delete the duplicate studies. Okay, this is very important. Okay, to delete the duplicate studies because maybe some studies they have so many duplicates there you have to delete. And the next, so after you guys listen my explanations before, so are you guys meta yet? Are you guys ready to do the meta analysis? Okay. If you get any question, it's very open for me. You guys to do it for, or maybe you guys type to the comment sections. And now we're going to the pairwise meta analysis. Pairwise meta-analysis, this is very common. Many people they use, or many people they evaluate the pairwise meta-analysis. But what is the basic term that we have to know about the pairwise meta-analysis? Okay, so when we talk about pairwise meta-analysis statistically combines the results of studies that compare two intervention head to head. Okay, so for example, I mean compare head to head is, okay, I want to compare intervention A and intervention B. So we call this as head to head. Okay, so only one intervention versus one intervention. So it's equal, pairwise, pair, okay? We cannot compare two intervention to the one control, no. Okay, cannot, okay? In Chinese, we say okay. Okay, so we just say one by one versus one. We call pairwise meta-analysis. As in the slides, for example, intervention A versus control, and also intervention A versus intervention B. Okay, so you guys know, you guys have the figure out about the pairwise meta-analysis. Okay, now let's go to the next. What is the type of data in the meta-analysis? Actually, the type of meta-analysis, mostly they have two types of data. So the first type of the data is the binary or dichotomous. Okay, binary, which is like only yes and no, only two category itself. Yes, no, alive or dead, improve or not improve, event or not event. Okay, so how if the data they provide in more than two categories? Yeah, of course, you have to change the data to the dichotomous data if possible. If impossible, just delete so you cannot use the data. Okay, the first one is binary, yes or no. Okay, two category only. That's the first data. For example, the mortality. How many the mortality? Yes or no? How many mortality? How many not mortality? How many malnourished? How many not malnourished? At least they have two times two tables. Okay, another term, two times two table. For example, like yes and no. Okay, when you compare to the cross tabulation, become two times two tables. It's needed for us to do that. Okay, so the effect size measures in the dichotomous data, they have risk ratio, odds ratio, risk difference, or hazard ratio as well. Okay, this is the effect size informations from the binary or dichotomous data. Okay, the first one is dichotomous data, and the second one is the continuous data. What is the continuous data means? Continuous data is measured on a numerical scale. For example, like depression score, blood pressure, weight, mean age, and then mean quality of life. If the data provided in mean SD, if the data provided in mean difference, or any kind related numerical data, we can use that. Okay, so in the continuous data, the effect size is HGG, Cochrane, Cohandy, or maybe the standard means difference. But mostly used is standard means difference compared to the HGG. Okay, so it's depend on you. You want to choose which one is HGG or SMD, or just the same. For example, HGG is the same with this standard mean difference, but applies a correction for a small sample a bias. So when the study they have small bias or something, you guys can refer to the HSG. Okay, but most of the study they use standard mean difference. So actually, I ever compare between the results evaluating using HSG and also the SMD, but actually they don't have much difference, only 0.0 something. Okay, so it's okay if you get confused. Oh, okay, in my first meta, I want to use the SMD. It's fine. That's totally fine. Okay, and now I'm going talking about the homogeneous and also heterogeneous. Okay, before I explain about the homogeneous and also heterogeneous, according to you, which study is better, homogeneous or heterogeneity or heterogeneous? Anyone of respond my question? Which one the study? Which one the study is better, homogeneous or heterogeneous? Sorry, which one is better? Ah, okay, Ibu Novita, homogeneous. Homogeneous is better. Anyone? Any response? Which one better, homogeneous or heterogeneous? Are you serious? Homogeneous is always better. Okay, when we talk about the study characteristic, homogeneous is perfect. It's good. Okay, but when we use the meta-analysis, which we include, which we retrieve from many kind of databases, we include the study from very countries. Of course, it will increase the heterogeneity. Increase the heterogeneity. For example, in the figures, it's very simple. They have the apple, pineapple, strawberry, and any kind of the fruits, right? We call this as the heterogeneity. So when you guys conduct the meta-analysis, heterogeneity is very common. It's okay, no problem. No problem. Don't you think that, my study is the heterogeneity in my study is high, which is very bad. No, you can evaluate what is the heterogeneity sources from your study. Later we discuss about this, okay? Um, okay, so what is the heterogeneity? What is the heterogeneity? Okay, heterogeneity refers to the variation in the effect size or outcomes between the study included in a meta-analysis. So highlighted variations in the effect size. Okay, so they have variations. And where is the source of variations come from? The variation can from the population characteristics. For example, in your study, you include the age range from 15 to 49. Okay, that's quite long. Okay, in maybe, for example, I'm conducting a study and my age classification is between 15 to 40 only. Other study, they conduct this age between 35 to 49 and any kind of range difference between age. Of course, it can increase the heterogeneity because your included studies, they have different age range. That's one example. Okay, and also the setting. For example, the study is conducting in the hospital, another study conducting in the community setting, or in the hospital. For example, the study is conducting in the ICU, other is conducting the general ward, or maybe other study conducting the emergency department or something. That's for sure increase the heterogeneity. Okay. Another one is like the intervention characteristics. For example, the dosage, the duration, and also the delivery way, the intervention, they also increase the heterogeneity. For example, I'm conducting the intervention A. My duration is 3 months interventions. Meanwhile, Ibu Prabha, she conduct the same intervention with my study, but due to the novelty, Dr. Prabha conduct the intervention. The duration of the intervention is 4 months, for example. They, of course, they have the very, or maybe the difference, the intervention durations, right? The length of intervention. This also increase the heterogeneity. So heterogeneity is very common in the meta-analysis. So you should not to be worried about the heterogeneity in your study, okay? And also the outcome measurements or instrument, for example. I believe you guys know that the quality of life instruments, they have so many kind of instruments, the quality of life. For example, I would like to conduct a study specific to cancers. I want to conduct a study specific to the cancers. So I'm using the quality of life, I'm using the quality of life instruments from the WHO. And other study, they use the quality of life tools specific from cancers. Those tools are okay, but they are different. Okay, so they can increase the heterogeneity as well. Okay, and also the study quality and also the methodology, because every people they have their own methodology style, and when it study it, which it also increase the heterogeneity. So if you want to get the homogeneity in the meta-analysis, is very difficult. You have provide a very strict inclusion criteria. Okay, if you have very strict inclusion criteria, it's very possible you will have homogeneity. Okay, but if you have very strict inclusion criteria, your included study is very small. If your study is very small, how can you generalize your finding? That's become the concern as well. Okay, next. Let's see from this. This is just a very short figure out. Okay, the study, the meta-analysis, inclusion criteria, all type of study. Okay, see, they include all type of studies, and also the bad news, they finally did a meta-analysis of all science, and it turns out not significant. Of course, if the study, the heterogeneity is too wide, they are not that specific enough, the study will not significant. Okay, so sometimes in the meta-analysis, we also need to address the inclusion criteria as well. Even we already set the inclusion criteria, the results of our finding maybe still have heterogeneity. That's fine, no problem. Okay. Okay, now this is how to quantify the statistical heterogeneity. How can we see the heterogeneity? Okay, or maybe if you guys only see from based on the characteristic of your study, that's still subjective from you. I will not trust on your judgment. So we can use the statistical analysis to evaluate the heterogeneity. We call this Cochrane Q, I-square statistic, and also task square. This is very common. Okay, very common of analysis. Don't worry, I'll show you later. Okay, in the meta-analysis results, you can see the heterogeneity. For example, you can use the Cochrane key if the p-value less than 0.10. Okay, the cutoff point 0.10, not 0.05, different. Okay, in indicating heterogeneity. Okay, and also the I-square, actually the I-square cutoff point, they have vary. Okay, it can be less than 25. We can say homogeneity. In other study, they have the cutoff point of 30% or 50% as well. So if, I personally prefer to the 30%. So if the I square more than 30%, then I would say it's high heterogeneity, and I need a further analysis.
Mr.
Okay.
Hidayat,
Yes, I have a limited time.
sorry. Yeah, you have 5 minutes.
Okay, I'm trying my best to
Yeah.
finish this. Okay, thank you, Dr. Poroba. And also that's task square as well. And now I would like to introduce you about the fixed effect and also the random effect. Okay, this is very common. Fixed effect, which is your study that have the homogeneity. When your study have homogeneity, you can see the effect, the fixed effect. The result will be fixed. The CI will be narrow. Okay, CI confidence interval between upper and lower, they can be narrow. Okay, and also the study mostly are homogeneity. Meanwhile, the random effect, if the study that have high heterogeneity, is offshore. Of course, this you guys need to see the random effect model. Okay, and also the CI may be widely, okay, or wider. This is the random effect. And also, how about the moderator analysis? What is the moderator analysis? So when your study they have high heterogeneity, okay, they have high heterogeneity. The moderator analysis you have to do, you need to evaluate the source of heterogeneity using the moderator analysis. Okay, so the moderator analysis, actually they have two types data. The first one is categorical data. If the categorical data, you guys need to do the subgroup analysis. And also if the continuous data, you need to do meta regression. This is two type analysis for moderator analysis. So many type of analysis, right, in the meta-analysis, of course. So that's why I just want to show you, this is like a brief information. If you want to do meta-analysis and comprehensive, maybe in the futures, we can conduct the workshop as well, okay? So how if the studies with more than two groups? Okay, I'm sorry, Ibu Prabha, maybe I need 5 minutes, okay? Because it's quite important to explain about the type of intervention, okay?
Okay.
Okay, so how if the studies have more than two groups, okay? For example, two group, group A, B, and C. Okay, this is very important for you guys to information. And how if the study they have more than control groups? Okay, because you guys have to know in the interventional studies they have many types of control groups. The first one is usual care. The second one is placebo. Okay, can be the placebo or sham. And also they have the active controls. They have no interventions. Okay, so you guys have to identify what is the type of control groups. And of course, if the study they have more than 2 groups, I have 4 scenarios that you guys have to remember. This is very important. Okay, the first scenario, splitting the control group. If in the study they have 3 groups, intervention group 1, intervention group 2, and also the control group. Okay, in our study, the intervention group 1 and intervention group 2, the intervention is related to my inclusion criteria. So we will include those 2 groups. Okay, so we have to compare intervention group 1 versus control group, intervention group 2 versus control group. And you have to remember the control group should be split in half. The population or maybe the number of the sample should be divided into. If the control group, they have 40, so IG1 versus 20, IG2 versus 20. Okay, we have divided the total sample in the control group. That's in the first scenario. In the second scenario, combining the intervention. Okay, for example, we think that the intervention group 1 and intervention group 2, they are similar to intervention and related to my study. And then I want to combine. Okay, when you just combine the total population in the control intervention group 1 and intervention group 2, and you compare to the control group. Control group no need to be divided to, no, because become one study only. But the total sample in the intervention group 1 and intervention group 2 should be combined. That's the scenario 2. And also the scenario 3 is splitting the intervention group. For example, the intervention group is okay, but in the control group, I would like to compare these 2 control group. So you compare intervention group to the control group 1 and also the intervention group to the control group 2. And you have to remember the intervention group should be divided by 2. This is the scenario 3. And the scenario 4 is excluding the irrelevant groups. For example, they have 3 groups, group A, B, and C. Intervention group 1 is related to my study. Okay, it's okay. But in the intervention group, this is not related to my inclusion criteria, so I need to delete. So you just compare between intervention group 1 compared to the control group. Okay, no need to be divided to be 2 per control group or either for the intervention group. Okay, so that's the 4th scenario that you guys have to remember. And this is the most software that we use for meta-analysis. I'm mostly using the CMA, Comprehensive Meta-Analysis, and also R, and also the Stata. But if you guys want to do like the Ratman, I think it's also okay. That's okay, also no problem. Okay, but for Stata and CMA is not free, but the R is free software. That's it. And this is just for your information. Finally we can see the result. These figures we called as forest plot. Okay, we call this as forest plot. Okay, and also in the forest plot, they have the 0 here, which is the line of no effect or cutoff point, or maybe the thresholds. Okay, even the term of threshold is not correct, but we can see this one. This is the line of no effect. This is the forest plot. For example, quality of life in head and neck cancers after receiving the swallowing rehabilitative therapy. So the intervention is swallowing rehabilitative therapies. To the quality of life, how many the results? Okay, let's see. The random effect, I'm using my pen now. Okay, so from the random effect, we see that the pool the pool effect is 0.46. Okay, and the fixed effect is the same one. And also we can see the p-value, all of them are significant. Okay, so to identify which pool effects does I have to take, whether fixed effect or random effect, you have to see the heterogeneity. Okay, next, this is the publication bias, also very important. Publication bias is when your study, when the effect size of your studies, they have a vary, or maybe they have outlier. or maybe the distributions between the effect size among your included studies, they are not balanced. We call this publication bias. I'll show you in the figures. Wait. So this is the publication bias. When we conduct the publication bias, we call this as the funnel plot. Okay, funnel plot. This is funnel plot. Okay, funnel plot. These figures is the confidence interval. Okay, and also the dot one. This is included the study. If the dots is morely skew left or skew right, I believe it will be indicating the publication bias. Okay, so if your study have the bias publication, what do you have to do? You can conduct another to evaluate the publication bias. You can do like statistical analysis. We call this eager regression test or background correlations or Peters test. This is already set in the CMA. So you just click, 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 and click, you will see this result. It's very easy. Okay. And also how if we find the publication bias. In my study, I have the publication bias, what I have to deal on it. You guys conduct another analysis. We call this Duval, Tweeney, and Trim analysis. Trim and fill analysis is mostly used to evaluate your publication bias. And also this is the results. Okay. This is the result. Do you think that this study, they are balanced or no? Anyone here can give a response? This is balanced or no balance? Okay. Because if we use the funnel plot, a funnel plot usually we can evaluate by visualizations. Maybe this is balanced, maybe this is imbalance. Okay. But to validate our visualization, we have to do the analysis like regression test. Okay. The p-value is 0.46 and the cutoff point is 0.1. Okay. So
Mr. Dayat.
Okay. Wait a moment. Only three
Yeah,
slides
yeah,
more.
yeah.
Okay.
Okay.
So we can see that this is no publication bias. So for the publication bias, the cutoff point is 0.1. Okay, not 0.05. This is the publication bias. And of course, this is the for example, the forest plot. Okay. This is the outcome for the sleep quality and also the depressions. We can see here's the publication, sorry, the I-square is 1.57%. And also the others forest plot, they have almost 50%. So when the study I-square is less than 30%, we choose the fixed effect, okay, to see this. And also for the I-square more than 30%, we choose the random effect, okay? And also this is the figures is refers to the CI. Okay, so actually you guys have to know to see the study is significant or not significant, we just see the CI. If the CI they cross the zero line, if the CI they cross, they I believe they will not significant. But if the study they do not cross the CI, if the CI they do not cross the zero line, will be significant as well. Such as this one, the study is provided the continuous data, as I told you in the very beginning, mean SD, and this study is using the binary data for hospitalization outcome, readmission. They have yes, no, also the mortality, death or no death. Okay, this is the binary. See, they use the one. The cutoff point is one, not zero. So, like odds ratio, when the study less than zero, it will be less likely. If your CI more than one, it will be more likely. That's almost the same thing. Okay, I'm sorry because I have a very limited time, so I have to finish my slides very soon. So if you have any question, I would love to share, and I would love to answer the question after this in the discussion section. I think that's all. Thank you very much, Ibu Prabhu, for the time.
Okay, thank you very much, Mr. Hidayat Arifin. Your presentation is very interesting, I think, but unfortunately, the time is over. Yeah, thank you very much. Okay, uh, I think, ladies and gentlemen, now I will go to the next session. Yeah, Joseph. Mr. Joseph, are you ready to continue your presentation?
Yes, I'm back.
Okay. Yeah. Our apologies, Mr. Joseph.
Yeah,
Mr.
my
Hidayat,
apologies because
kindly continue to the session. Okay.
Okay.
Okay. Thank you. Can you share your presentation?
Okay.
I'm sorry, your time is about 20 minutes.
It's okay.
Yeah, your screen is yours. Yes.
Can you see my screen, right? Can you see my screen?
Yeah, I am.
Okay. So, sorry for the inconvenience. I would like to continue. From previously, I said the review process usually comprises of identifying the research question, identifying the relevant studies, performing study selection, conducting data extraction, then finally summarizing and reporting our results. As I previously stated, identifying the research question is the most important part. And the two types of review follow the PICO criteria and the PCC. Another thing is that we need to ensure that we register our protocol before we go further into the review. And I also stated that based on the reporting guidelines, we need to follow the reporting guidelines for the specific type of review, whether it's systematic review or the scoping review. For systematic review, we use the Prisma P, and for the scoping review, we use the Prisma scoping review. So once we identify the topic, the question, we register our protocol and develop our protocol. Then we go to search. So there are different international, regional, and maybe country databases. Most of the international databases maybe include PubMed, Cochrane, Scopus, Embase, and Web of Science. For the study selection, the study selection is based on the PICO or the PCC. So for the systematic review, the PICO stands for the population, intervention, comparator, and the outcomes. So for example, you would include maybe adults with, let me see, okay. You have adults maybe greater 18 years with a certain condition, but the year should be dysphagia. And the intervention, maybe you are looking at stimulation therapies. The comparison, you compare with sham therapy. And for the outcomes, you might have swallowing function, aspiration, transit time, and dysphagia severity. For the scoping review, you can be the same. The population can be the same. The concept, here we are focusing on the intervention, and the context can be to focus maybe on a particular area, maybe it's the community, or maybe hospital base, or maybe other institutions. And for the type of screening, you can screen manually based on different types of screening tools that are available. You can use EndNote and the others, but there are also maybe AI based like Covidence or Ryan, which can help you to screen the study based on your inclusion criteria. Once you identify the studies, you go into the data extraction phase. And for the data extraction phase, there is no standard format. You could go and check maybe previous studies that have been done, and maybe you can follow the format. Uh, After the data extraction, then you can conduct the risk of bias, which is to check the quality of the included studies. And the quality of included studies, there are different versions of quality of assessment tools. And for observational studies, you can use Newcastle or Tower scale. And for randomized controlled trials, you can use RB2, the Cochrane RB2. And for the non-randomized controlled trial, we also have the Cochrane Robbins one. Finally, once you do your quality assessment, you summarize your data. It can either be quantitative or qualitative, and then you report your results. So for the types of information that you need to report, you need to report your selection process, description of the, you can have the description of the study or the interventions that you want to include, or depending on the type of question that you are trying to answer. And for the reporting, this is just an example of a completed Prisma flowchart, and which is part of the process of screening the studies. So you have the number of studies that you collect from the databases, then the type, the screening methods by title and abstract, the studies that you exclude. Then you have studies that you assess for eligibility, and based on your inclusion criteria, you also exclude them and have the final included studies in your review. For the type of characteristics, you can include demographic characteristics, which include maybe the study themselves, maybe participant characteristics, and interventional characteristics, plus the type of outcomes that you want to assess in your study, and if it's in an interventional study, at what time point are the interventions measured. So regarding the differences between the systematic review and the scoping review, the process is the same, but for systematic review, we are trying to identify and maybe place evidence for a specific research question. While for scoping review, we are trying to identify concepts or a broader version of the research question, or so that we identify maybe the theories and gaps in research. So when we need to consider to do a scoping review, so we can do this as a precursor to conducting a systematic review. So because we are trying to assess a broader area, like we say dysphagia treatments. So this is like a broader area, and for the dysphagia treatment, you have maybe swallowing exercises, you have stimulation therapies, and maybe compensatory techniques. So for the scoping review, you want to check all the interventions, and maybe difficult to perform quality assessment. And you can include all types of designs because you just want to check if these types of treatment work for dysphagia, whether the exercise, the stimulation therapies, or the compensatory techniques. So, as I said, the scoping review includes a broader research question. And the main point is to clarify and examine maybe key concepts and the topic regarding that area, and to identify knowledge gaps which we can use to develop or to conduct a systematic review which is more specific in the future. So for when to consider to conduct a systematic review, here we are trying to narrow our focus to maybe a more specific area. So, like from the broader types of dysphagia treatment, maybe we just focus on swallowing exercise only, or we focus on stimulation therapies only, or we focus on compensatory techniques only. So, we are trying to address maybe feasibility or effectiveness of a treatment, or maybe we need to identify if there are conflicting results among a particular type of treatment. Let's say maybe swallowing exercise, there are different types. Some say some are effective and some are not effective. Then there we can conduct a systematic review. So in general, for a scoping review, the question is more broad, while the systematic review, the question is more focused. For the eligibility criteria for scoping review, it's more flexible. It can include all kinds of is more broader than while the systematic review maybe is fixed, and maybe we can set based on previous evidence or research. And for the results, because it's too broad, then the results are more larger or more comprehensive than for a systematic review, which is particularly focused on a few maybe outcomes. While for another, for the appraisal scoping review, maybe we, because it's different kinds of studies, so it's difficult to conduct maybe quality assessment. While for systematic review, we might be focused on a particular type of study design, which will be easier to conduct the quality assessment. Then for the reporting guidelines, we use Prisma scoping review for scoping review, and Prisma P for systematic review. And overall, for the analysis, the scoping review is more broad, while the systematic review is more specific. I think that's all I had to prepare for you. I'm welcome to receive any questions.
Okay, thank you, Mr. Joseph, for your interesting presentation. Yeah. Okay, now is the time for Q&A session. Yeah, I will read some question in the chat room to Mr. Hidayat. Yeah. What strategies would you recommend for dealing with extreme heterogeneity and inner pathways meta-analysis? Yeah,
Ah,
Mr. Hidayat, can you answer the question from Ibu Aulia?
Okay, sure. Thank you, Bu Prabha. This is the questions. What is the strategies would you recommend for dealing with the extreme heterogeneity and a pairwise meta-analysis? So as I told you before, that in a pairwise meta-analysis or any kind of meta-analysis, the heterogeneity is very common. It's very okay. It's very okay. So if you have any heterogeneity, what do you have to do? You have to evaluate the source of heterogeneity. As I mentioned you before, that the source of heterogeneity, they can be from the participant characteristics, from the study characteristics, from the tools to evaluate the outcomes, from the study quality itself. So we have to evaluate. Okay, so we have to evaluate what is the source of heterogeneity. So how we can evaluate? We need to do the moderator analysis. Okay, we have to do the moderator analysis. If the study, they use the categorical data, so we have to do the subgroup analysis. If the study use the if the study use the continuous data, and then we have to use the meta regression. Wait a moment. I will show you the example for my data when I'm conducting the moderator analysis. Can you wait a moment? I need to find the files. It's right here. Okay. Mm, Can you see my screen?
Yeah, yeah.
Okay, the screen's about the table 2, is it correct? Okay, so actually this is the the results from the moderator analysis. For example, in my study, for the outcome swelling function, oral intakes, quality of life, and also pain, they have high heterogeneity. So I want to evaluate what is the source of heterogeneity. Okay, so if the data, as I told you, the data they use the continuous data. Okay, so I use the meta regression. If the data they provided in the categorical data, then I use the subgroup analysis. For example, mean here's they provide the the age, they provide the mean data. Okay, so when I analyze, this is the results and of significant. So we are trying to evaluate which one is the significant moderating the outcomes. For example, for the swallowing function, what is the significant moderator analysis is, okay, in the subgroup. Okay, we can see from the highest HSG. Okay, so from the intervention duration more than 8 weeks, this is significantly moderating the outcome for the swallowing functions. Okay, maybe this is the information we can retrieve from the papers. Okay, so if you have a very small, or maybe if you have very limited number of included studies, of course this is very difficult for you when you want to conduct the moderator analysis itself, and you have to address in your limitation of your study. Okay, so this just the example for you to evaluate and how you deal with the high heterogeneity. Okay, any other question?
Thank you for your answer, Mr. Hidayat.
Okay.
Yeah, I think your explanation is very clear. Yeah, thank you very
Mhm.
much. Yeah. I will continue to the next question from Mr. Rohmani to Mr. Konwani and also Mr. Hidayat Arifin. How can I develop high quality scoping and systematic literature review article that can be accepted in Q1 journal? Yeah, Mr. Rohmani want to ask the strategy, yeah, for can accepted in Q1 journal.
Okay, brother, I think you can answer first how the strategy, because I believe that my brother Konwani Joseph, he has published many kind of papers in the Q1 journals, and overall his publication in the Q1 journals.
Okay, thank you for your question, Mr. Rohimani. Uh, to develop a high quality scoping review, I think as I explained before, the most important part is you have a question that has not been done by others previously. So once you have the question, you go and search to find out if others have already done the same similar topic. Because once somebody has already done that topic, the reviewers will just say, this was already done, and then reject it, because you are not bringing in new knowledge. So you have the idea, you search first. If others have done it already, maybe you try to check where the gap is, what they did not do. Then you can do that part. Then you bring in new knowledge. But if you do the same similar thing, I think there will be no new knowledge that you'll be adding to the evidence base. So reviewers would just reject it. Another thing is that you have to follow the process. So you have your question, you search, you register your protocol. That if you register your protocol, that means you have already searched and found out that nobody has done what you are trying, the research question that you want to answer. And if somebody wants to do the same, we cannot do it because you have already registered your idea in a formal maybe registration platform. So everybody will go there and say, oh, Mr. Rahmani wants to do this, and they cannot do it. I think that's you follow the appropriate scientific guidelines and make sure that when you are starting your review, nobody has done the study or the research topic that you want to do. Then it will be easier. But doing that does not necessarily mean that you publish. But as time goes along, you can refine your study and make it better. Yes.
Okay, can I provide any information, my bro?
Yes.
Okay,
Yeah,
so
thank you,
I'm
Mr.
actually.
Hidayat. Yeah,
Oh, okay, Ibu Prabha, thank you very
yeah, it's
much.
okay,
I'm so
Mr.
sorry.
Hidayat. Thank you.
Okay.
Yeah,
So actually what Dr. Joe say is about the novelty. So you have to make sure the novelty of your study. That the first important thing. Okay, so you have to make sure when you want to conduct a systematic review or scoping review, you have to type in Google first. It's in an easy way, in the easiest way. If you have the similar or the same topic in the scoping review, come on, you have to find another topic. Okay. Or you can improve to the systematic review or even in the meta-analysis. It can be one of the novelty of your study. Okay, that's the first point. Novelty is very important. And also the second one will be about the strategy or maybe the steps that you conduct the scoping review. So the methodology is play very important thing, especially for the keyword and the search strategy. Okay. And if you think that you have a limited source for databases, you have to collaborate with other scholars. For example, in my university, I only have a very limited databases. For example, my university only purchase for Scopus or only purchase Web Science, which is very limited, right, for the databases. So you have to collaborate with other scholars that the university they purchased the other databases as well. So your databases can be improved. Okay. So if I were you, actually in GBI, based on the GBI, they suggest for the scoping review that the databases should be minimal two. That's based on GBI, minimum, okay? For the scoping review, minimum is three. But if you can provide more databases, which is your search will be more comprehensive, okay? That's become also the point. Okay, that's it. Okay, the first point is novelty. You have to make sure the critical part is the novelty of your study. Okay, I think that's all. Dr. Prabha, thank you.
Okay, thank you for your answer. The important point is the novelty and also the strategy. Okay. Uh, Go to the next question from from Miss Arina. Yeah, for Mr. Joseph. Miss Arina asks about. I would like to ask about the systematic review. Systematic review often require critical appraisal of included study. How should researcher handle quality appraisal when doing scoping review? Okay, Mr. Joseph.
Oh, yes. For scoping review, because maybe it's too broad, so you can include many kinds of design. So it will be difficult to conduct. It's difficult to conduct critical appraisal because you have different types of study designs. Because the idea for the scoping review explore the is to explore a concept, maybe is to explore what studies maybe have been done, or what interventions have been done there, or because you can include all kinds of designs. That's why it's difficult to conduct the critical appraisal. But for systematic review, because it's a very specific, we focus maybe on I mostly do dysphagia. So it may be swallowing exercise, the effect of swallowing exercise on this in dysphagia patients. So it's too specific. But if I want to explore the types of rehabilitation therapies for dysphagia, that means it's too broad. So, and I can include all types of study designs, whether it's cross-sectional or randomized control trial or any kinds of non-randomized control trial. So you have it's like mixed, but you just want to have a broad idea of what has been done there. Or for systematic review, because it's very specific, then maybe you choose only the randomized control trial, and you can be able to do the quality assessment. If you focus on maybe prevalence of a certain disease, you only choose maybe observational studies, it will be easier to conduct the critical appraisal of those. If you choose non-randomized control trials, same. There are tools that are used to assess their assessment. But for scoping review, I think it's difficult to conduct critical appraisal because there are different types of study designs that you use.
Okay, thank you, Mr. Joseph, for your answer to Miss Arina. Go to the next question from Miss Nita and Nana for Mr. Hidayat Arifin. Yeah, two questions, Mr. Hidayat Arifin. Yeah. From Miss Nita. Mr. Hidayat Arifin mentioned that for qualitative study, the appropriate approach is metasynthesis. So, could you please explain how present metasynthesis in the paper? Yeah, and the second question is from Miss Nana. Can we just analyze the data from more than two groups without doing adjustment like what had been explained? Okay, Mr. Hidayat
Okay, sure.
Arifin can answer two questions.
Okay, thank you very much for the questions from Mrs. Nita. Okay. To be honest, I never doing the meta synthesis for qualitative study because I think I have declared myself that I am a quantitative person. But it's okay. I have read just a little bit about the meta synthesis, especially for qualitative study. So it's very different with the meta analysis. Which meta analysis we calculate the number. We have the quantitative analysis, but the meta synthesis no, they will calculate not they will not they don't have any calculations. They just like doing the interpretation for the themes, the subthemes, or anything. So actually it's mostly similar with the systematic review for qualitative studies, or we call this as metasynthesis as well. Okay, so if you want to do the metasynthesis in the qualitative studies, you have to like make a summarize, or maybe you have to make like the combine or any interpretations from the themes, sub-themes, or any kind of the very important informations in your qualitative studies. That's we call the metasynthesis as well. Okay, like we combine from many kind of the qualitative studies to be the one qualitative metasynthesis. So it doesn't mean like this. So it doesn't mean like with the scoping review, you mentioned like, oh, okay, from many studies, they have 3 studies mentioned about the quality of life themes. No, but you have to reanalyze, you have to recoding based on the study as well. So you can provide the new themes related to your included studies. So actually that's the point when you want to conduct the metasynthesis. Okay, I hope it's clear for Mrs. Nita. So it doesn't mean you collect like systematic review, okay? Systematic review, you compile, this is the theme A, theme B, theme B, and then you compile to be one. That's the scoping review, no. But in the meta-synthesis, you have to reanalyze to be one, the new theme or something, but should be related to the previous theme or sub-theme in your included studies. That's the point. Is that clear? Okay, sure. Thank you. And also the
Yeah.
second question, and can we just analyze the data from more than
Mrs.
two?
Nana. Yeah.
Okay. Can we just analyze the data from more than two group without doing adjustment like had been explained? Okay. So previously I have for scenario, right? For the study for the pairwise meta-analysis, if they have 3 groups. And can we not doing like that? No. Actually, if you are going to do like that, the CMA or the software, they still can analyze. But something you have to remember, if you didn't do like the scenario, it will increase your I mean like the results will be biased on that. Okay. So you have to be careful. If other peoples they knows that you are doing the mistake during a meta-analysis, it can be debateful. Okay. So the correct one, you have to do the scenario. Okay, you have to see the first scenario which is related to your study. If they have more than 2 groups, you have to do like that. So I would like to suggest just do scenario. That's very important. That's the correct thing. Okay, if you didn't do like the adjustment that I mentioned before, what are you doing? Is not correct. Sorry. I have another questions for Hidayat. What are the best consideration to include or not include studies with high risk of bias? Okay, so this is another question. Can I directly answer, Ibu Prabha?
Yeah.
Okay.
Maybe. Yeah.
Okay, so that's the first question for Ibu Nana. Is that clear? So I would like to suggest you follow the scenario, okay? If you don't do the scenario, your result will be wrong. Your result may be significant, but it's wrong from the methodology, from the rigorous methodology. Okay. And also for the second questions, can we still consider to include or not include the study with high risk of bias? It's okay. It's okay. You still can include the high risk of bias, for example. But you have to conduct the sensitivity analysis. Oh my God. So this is another analysis. Why so many analysis in the meta-analysis? It's okay. That's called, we call metani lah di Jawa nih gitu ya. Di Jawa kan metani gitu kan. Why I become Javanese now. Okay, so you have to do another analysis. We call the sensitivity analysis. For example, from 10 included studies, I have one study, they have the high risk of bias. Okay, the first one you analyze for all and you find the results. Okay. And the second one, you have to delete the study with high scenario, with the high risk of bias, and then you analyze. And then you compare between the first analysis and or without, and then the analysis with the high risk of bias. If the CI, they still have cross intertwined, so it can be said, the results is robust. So you can still use for that. So you should not delete. You still can include, but you have to do the sensitivity analysis. That's how to deal with the high risk of bias if there is in your included study. Okay? High risk of bias. Okay, I think that's all.
Yeah, thank you, Mr. Hidayat.
Mhm.
Yeah, from Mrs. Nana, I think enough, yeah, or the answer from Mr. Hidayat. For Mr. Joseph, yeah, you have one question that not already answered, yeah, from Ibu Aulia, yeah. Could you briefly explain the fundamental differences in purpose between a scoping review and systematic review, especially in terms of research question and expected outcome? Yeah, question from Ms. Aulia.
Oh, okay. Thank you for the question. I think for the fundamental differences in the two, because for scoping review, as we said, we are trying to explore the broader context of the research question. So for this one, I would say, for example, maybe we say, what are the types of rehabilitation intervention for dysphagia? So it's like we include all types of rehabilitation intervention. That's for a scoping review, and for a systematic review, maybe we say, what is the effect of swallowing exercise for people with dysphagia on it, because that means we are only focusing on the swallowing exercise and the effect of the swallowing exercise in people with dysphagia. And for the expected outcomes for scoping review, because it's very broad, so you can include all kinds of outcomes that are available. So it can be descriptive or quantitative. But for the scoping review, because you maybe you target only randomized control trial, and in the randomized control trial, they have specific outcomes that they report. And based on those outcomes, you report the ones that maybe are mostly reported in those randomized control trial. So for the outcomes, for scoping review, you can include all kinds of outcomes because you are trying to understand the broader concept. While for the systematic review, because it's very specific and it will have very defined outcomes that you need to report in the study. I don't know if that is clear enough.
Yeah, thank you. Saulia is
Thank you.
already here.
Yes, yes.
I'm sorry, can I provide like a little bit addition about the fundamental
Okay.
related to the research question, right?
Yeah.
Okay, so if you want to conduct between the scoping review and the systematic review, I think it's clearly defined by Dr. Joe. So the question for the scoping review is more broad. Okay. But for the systematic review, it's narrow. Okay. So for example like this, I want to evaluate what is the intervention to improve the quality of life among children with stunting, for example. So you will identify what is the type of the interventions. The question is broad, right? So that's very related to scoping review. But if you want to conduct the systematic review, the question should be more specific. For example, you have identified the type of intervention. What is the effect intervention A compared to control group? Okay, so that's more specific. The effectiveness of intervention A compared to something. What is the effect size? What is more significant or something? So that's the question will be more specific. I think that's all the easy way to figure out the difference between scoping and systematic review related to specific questions. That's all. Thank you.
Thank you, Mr. Hidayat. Yeah. Go to the next question from Miss Nana. Yeah. To Mr. Hidayat also. Yeah. What are the best considerations? Already. Yeah. Okay, Mr. Hidayat. I'm sorry. Yeah. Is there any question? More question? Ladies and gentlemen. Okay. I think clear, yeah, the explanation from our two speakers, yeah. Okay, ladies and gentlemen, now allow me to share my screen, yeah. Please share screen to present the certificate as appreciation for our two speaker today. Thank you, Mr. Hidayat Arifin and Mr. Joseph. Okay.
Thank you.
You're welcome.
Thank you.
Mr.
Thank you.
Joseph and Mr. Hidayat Arifin. Yeah. Okay, ladies and gentlemen, I have a conclusion for today webinar. Yeah, that meta-analysis remind us that single study often cannot stand alone as a strong evidence. Yeah, meta-analysis helps to overcome this issue by bringing together results from several studies, producing the clearer and more confident estimate of the true effect. Yeah, ladies and gentlemen, we have now react to the end of the today's webinar. On behalf of the organizing committee, we extend to our deep appreciation to distinguished speakers, Mr. Joseph and Mr. Hidayat Arifin. It is our hope that this webinar has enriched our knowledge and inspired to stronger scientific writing and publication in the field of the Pediomaternal Nursing Journal. Thank you once again for your participation. We look forward to seeing in our future academic event. So now the next session to Ibu Aulia.
Okay.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, thank you, Ibu Prabha. Thank you to all speakers, Mr. Jo and Mr. Dayat, and all participants for the rich exchange of knowledge during the session today. Before we close, here are a few reminders. Please fill out the evaluation survey and absent attendance. Which will be shared in the chat box. And then virtual group photo will now be taken. Please, all participants, open the camera. Udah, minta tolong difotokan. Okay, give your smile. Best smile. Okay, 1, 2, 3. Okay, next, page 2. 1, 2, 3. Okay. That concludes of academic writing and publication webinar, turning evidence into one meaningful paper. On behalf of Pediomaternal Nursing Journal, Faculty of Nursing Universitas Airlangga, I'm Aulia, thanking you for your active participation and very enthusiastic. We hope to see you again in future academic event. Have a wonderful day and stay safe. And then the session is officially closed. Thank you all participant and see you next time. Assalamualaikum warahmatullahi wabarakatuh. Selamat siang semuanya. Jangan lupa bisa mensubmit ke jurnal kami di Pediomaternal Nursing Journal. Terima kasih semuanya.
Terima
Ya,
kasih.
thank you.
Sebagai panitia.
Untuk PowerPoint nanti dikirim panitia ya, untuk
Oh ya,
materi.
untuk
Wow, ya.
PowerPoint dan materi nanti kami kirimkan beserta ada
Certificate.
sertifikat dari panitia melalui email. Terima kasih semuanya.
Sure, thank you everyone. Bye-bye. See you.
Okay, bye-bye. Thank you so much.
Bye. See you.
Thank you.
Okay.